Hello, welcome to any community. In this particular video, we are going to discuss the concept of Samprapti Ghataka. From the past several videos, we are discussing about the concept of Samprapti, that is pathogenesis based on Ayurveda principles. The three main determinants of Samprapti, that is Dushya Dosha, Anu Visarpana of the Dosha, and Amayasa Nirvritti. After that, we have discussed about the types of Samprapti, their significance with relevant clinical examples. So, as far as the pathological processes, it's their easy understanding are concerned, we have to understand the concept of Samprapti Ghataka. Samprapti Ghataka comprises of two terms. Samprapti refers to the pathological events and Ghataka refers to components. It is mentioned by the later authors, that is Samprapti Vighatanam eva chikitsa. It's not the actual reference that is available in original Ayurveda textbooks. Samprapti Vighatanam eva chikitsa. So that means when you are saying about chikitsa, it is Samprapti Vighatana, that is breaking of the Samprapti is considered to be chikitsa. It requires three components, that is analysis of Dushya Dosha, analysis of Anuvisarpata of the dosha, and analysis of Amayasa Nirvritti. For this, we have to know about what are these different components. So they are as follows, that is dosha that is being involved, whether it is Sharirika dosha or Manasika dosha. Sharirika dosha in the sense the person may be having Vata, Pitta or Kapha, and Manasika dosha in the sense the person may have Rajo dosha dominance or Tamo dosha dominance. As far as Dushya involved, that means we have to identify the Dhatu or Mala afflicted. When you think about the Srotas afflicted, we have to identify whether it is Bahya Srotas affliction or Abhyantara Srotas affliction. As far as Srotodushti Prakara are concerned, we have to know or we have to identify, that is whether the person is having Ati Pravritti or Sangha or Vimargamana or Siragranthi. As far as Agni are concerned, we have to know about the status of Agni, whether is it in the Mandya stage or poor functioning, or Agni Vriddhi or increased functioning, or improper functioning. That is, we have to see about it, and we have to know whether it is Jataragni is being afflicted, or Dhatwagni is being afflicted, or Bhutagni is being afflicted. As far as Ama is concerned, whether this particular Ama is happening because of Jataragni, or because of Dhatwagni, or because of the Bhutagni. As far as Udbhava Sthana are concerned, whether it is Amashayajanya or Pakvashayajanya. Vyakta Sthana, Sanchara Sthana in the sense the person may be having the movement of these vitiated dosha all over the body or in any particular part of the body. As far as Vyakta Sthana are concerned, we have to know about the actual Pratyatma Lakshana, where it is being located. As far as Vyadhyavastha are concerned, Sama or Nirama stage, you have to identify whether it is Ashukari or Chirakari Vikara, we have to know, or depending upon the presence of the dosha, whether it is Uttana or Gambhira has to be known. As far as the clinical manifestation are concerned, we have to know about whether it is Antarvega or Bahirvega as such. Involvement of the Rogamarga is concerned, we have to see whether it is the Abhyantara Rogamarga or Bahya Rogamarga or Madhyama Rogamarga affliction is being present or not. Sadhyasadhyata are concerned, whether this particular disease is considered to be Sukhasadhya in nature, or Kritshasadhya in nature, or Yapya in nature, or Pratyakshaya in nature. As far as Vyadhi Prakara are concerned, we have to know about whether it is Adibala Pravritta Vikara or Janma Bala Pravritta Vikara, like that, or whether the disease is considered to be Mrudu Vikara or Madhyama Vikara or Atimatra Vikara, or whether the person is having either Vataja Vikara or Pittaja Vikara or Kapaja Vikara, or whether the person is having the Sadhya or Asadhya Vikara, or whether the person is having Mrudu or Daruna Vikara. Depending upon the cause as such, we have to know about whether it is Nija Vikara or Agantuja Vikara. These are the different components of Samprapti Ghataka. Now we are going to discuss in a little bit elaborate manner. When you think about the dosha involved, as we have said earlier, which type of dosha is afflicted, whether it is Sharirika dosha or Manasika dosha. So the Sharirika dosha, in the sense, the person will be having either the involvement of the Vata, Pitta or Kapha. So that means Vata dosha is having specific lakshana, that is the Vruddhastha kurute nila karshya karshna ushna kamitva kampana shakridgrahan balanidrendriya bhramsha pralapa brahmadinata. When you think about the Pitta, Pita Vinmutra Netratva Kshudra Halpa Nidrataha Pittam. As far as Kapha are concerned, Shleshmagni Sadana Prasekalasya Gauravam Shvaitya Shaitya Shruthangatvam Shwasaka Sati Nidrata. But when you think about the Dosha Kshaya, are also possible because of the Nidana Sevana, but this will be responsible for the increase of other dosha. For example, if Kapha Kshaya is there, then we are going to get Vata Vriddhi itself. This Vata Vriddhi is responsible for the disease manifestation. In that way, we have to think of. As far as Manasika dosha are concerned, there are Rajasika and Tamo dosha. Rajo dosha, when you think about it, so there will be instability of the mind will be observed, whereas Tamo dosha, in the sense where the person will be having the laziness or the lethargy will be observed there. Further, we have to know about, depending upon the Nidana Sevana, is there any one dosha involved or two dosha involved or more dosha are involved in the disease manifestation. For example, if the person is consuming Shita Gunayukta Ahara, there may be a possibility of either one dosha itself increase, either Vata or Kapha, or there may be a possibility of dual dosha involvement. That means Vata or Kapha dosha may be afflicted also. If the person is consuming more amount of this Snigdharasayukta Ahara, there may be a possibility of increase of either Pitta or Kapha dosha, or there may be a possibility of increase of Pitta and Kapha dosha also. In that way, so depending upon the Nidana as such, we have to think of what might be, whether it is one dosha is involved or two dosha is involved. Further, Vruddha or Kshina dosha, whether is it being present or not. So here, Vruddha dosha will be having the importance rather than the Kshina dosha. Further, whether this particular vitiated dosha are in the Sanchaya stage or Prakopa stage or Prasara stage or Sthana Samshaya stage or Vyakta or Bheda stage, that has to be analyzed. Depending upon the Lakshana, the number of Lakshana and dosha manifestation. So that means we have to identify which is the main dosha afflicted or which is the sub dosha that is being afflicted. That means pradhana dosha or apradhana dosha. When the person is consuming more amount of the kataprasayukta ahara, there may be a possibility of increase of all the gunas of the vata dosha there. So that is ushna, ruksha, etc. that is going to get increased. That means that person may have increase of all the gunas of vata dosha that may be increased there. Or if the person is consuming more amount of the pruthuka or bittern rice, there may be a possibility increase of ruksha guna in the body. So like that, which particular guna is increased, that has to be analyzed. Further, whether the dosha is present in the Sama or Nirama stage. Sama or Nirama stage in the sense Vayu Sama Yubandha Sada Tandrantara Kujanai Vedana Shupanisto de Kramashongani Pedayan Vichare Digapachapi Grinahati Kupido Brisham Nehadye Vridhimapnut Suremekho Daye Nishi. This is in relation to the Samavata stage. Durgandam Haritam Sham Pittamamlam Stiram Guru Amlika Kantahriddah Karam Samam Vinirdishe. Sama Pitta Lakshanas as such. Avilastantulasthana Kantadesha Vadishtate Samu Balasu Durgandha Kshudadgana Vikhatakrit. This is in relation to the Sama Kapha stage as such. Whether this particular dosha, which is responsible for the disease manifestation, whether is it in the Sama stage or Nirama stage, that has to be analyzed. Further, whether there is any Prakrita dosha stage or Vikrita dosha stage, that has to be analyzed. That means when the vitiated dosha, that means Vata dosha is being vitiated in Varsha Ritu, that is considered to be Prakrita dosha stage itself. If the person is having the Vata dosha increase in the seasons other than Varsha Ritu, then it is considered to be Vaikrita dosha stage. So like that, whenever if you are looking into the dosha involved, we have to look into all these different parameters. As far as Dushya afflicted are concerned, what kind of the Dushya are being afflicted? Whether is it Dhatu affliction or Mala affliction? If that is there, are they in the increased state or decreased state? That has to be analyzed. So that means to analyze these aspects, you have to know about the Dhatu as well as Mala, Vriddha, Kshaya, Lakshana. Then only we can able to analyze this particular aspect. For example, if the person is having the Agni Sadhana, Praseka, Alasya, etc., then we are going to say the person may have the affliction of Rasadhatu. Mamsam Gandharbuda Granthi Gandorudara Vrittita Kantadishwadi Mamsamcha. If you are getting that, the person may be having the Mamsa Vriddhi in the body. Medasi Swapanam Katya Prikno Vriddhi Krishangata. If you are observing that, the person is having the Medakshaya in the body. Asthana Majjani Saushirim Brahmastimira Darshanam. This is indicative of the involvement of the Majjakshaya in the body. Mutre Mutrayet Krichra Vivarnam Sastrameva. Mutrakshaya Lakshana. Mutrakshaya can be predicted because of these Lakshanas present in the body. So like that, we have to know about the Vriddha Kshaya Lakshanas of Dhatu as well as Mala. So further that is being mentioned that is the Sastra Mutra Pravatti may indicate Mutra Kshaya, etc. As far as Srotas involved, here one has to analyze the Bahya Srotas affliction as well as Abhyantara Srotas affliction. For example, if there is the exposure of the Nidana through the nose, it's a Bahya Srotas itself. The initial Lakshana will be observed in the nose itself or around the nose itself, such as itching around the nose or sneezing or the running nose or cough or sputum, etc. If the person is having the exposure of the Nidana on the eyes, the person may have the itching around the eyes or redness of the eyes or running, that the secretions through the nose can occur. If the person is having the exposure in the ears, the person may have the itching, the person may have the redness of the ears, etc. If the person is having the exposure of the Nidana through the urethra, the person may have burning micturition, hematuria, etc. If the person is having the exposure at the anus as such, the person may have the painful defecation, the person may develop the bleeding through the rectum as such, that may be possible. So that is the affliction of Bahya Srotas in terms of Nidana exposure has to be analyzed. As far as Abhyantara Srotas are concerned, we need to know about the Lakshanas as such that is Dushti Lakshana or Viddha Lakshana has to be analyzed. That means if the person is having the Atisrishtam Atibaddham Kupitam Alpalpam Abhikshnam was Shabdashulam Uchvasantam Drishtva, we are going to predict the involvement of Pranavaha Srotas. Ashraddha Charchishya Vairasamarasadnyata Nirlaso Gauravam Tandra Sangamardo Jvarastamaha Panduttam Srotasamruddha Klaibyam Sadha Krishangata Nashogne Rayatha Kalam Valayaha Palitanisha may indicate Rasavaha Srotas affliction. Adhyasthidanto Dantaste Vedashulam Vivarnata Keshalamana Kashmashru Doshashasti Pradoshachaha may suggest the involvement of Astivaha Srotas. Asvedanam Atisvedanam Parushyam Atishakshnatam Angasya Paridaham Lomarsham Cha Drishtva. Svedaha Srotas affliction can be predicted. Akroshana Vinamanam Mohana Brahmana Vepanani Maranam Va Bhavati may indicate Pranavaha Srota Vidhata. That means injury to the Pranavaha Srotas can be predicted. So like that, we have to we have to know about the Lakshana which are being mentioned in the textbooks to say about the Srotas affliction. So here a few examples are being given. Asragdara, that is excessive menstrual bleeding, may indicate Raktavaha Srotas affliction. This is being predicted by the Kushta Visarpabdaka Raktapittam Asragdaraha based on that. Plus, there may be a possibility of Artavaha Srotas affliction also. Sashula Mutra Pravritti may indicate the Mutravaha Srotas affliction, as it is being mentioned that Atisrashtam Atibaddham Prakupitam Alpa Alpam Abhikshnam Va Bahalam Sashulam Mutrayantam Drishtva. Mutravaha Srotas affliction. Jihva Shosha may indicate Udakavaha Srotas affliction. Jihva Tal Voshta Kantakloma Shosham Pipasa Chati Pravruddham Drishtva. So like this, when you are analyzing this, we can able to predict the Srotas afflicted. As far as the Srotodushti Prakara are concerned, so 4 types of Srotodushti are being mentioned in the textbooks: Ati Pravritti, Sanga, Vimargamana and Siragranthi. When you think about Ati Pravritti, that has to be observed through the natural course of movement. So that means there will be the excessive movement of the fecal matter, excessive the formation of urine or excessive menstrual blood flow can be observed, and they are considered to be Ati Pravritti itself. So that means the person is suffering from Atisara, or the person is suffering from Prameha, or the person is suffering from Asrigdara or Shweta Pradara, etc. We are going to consider that as Ati Pravritti. Whereas if the person is having the excessive vomiting, this is not being considered as Ati Pravritti, because that is happening in the reverse direction than their natural course of the movement of the substances in the alimentary canal. That is why the excessive vomiting is not considered as Ati Pravritti. Rather, it is considered as Sanga and Vimargamana. Sanga is happening in the Amashaya Pradesha, that is resulting in the reverse movement. That means the Viloma Pravritti of the Pranavata, that is resulting in the person may develop the Chardi or vomiting. Or otherwise, the person is suffering from swelling in the suprapubic region. That is mainly indicative of Sanga and Vimargamana as such. Probably it could be either urethral stricture, or probably it could be the prostatic enlargement, or probably it could be cystocele or etc. that can be predicted. Sira Granthi. When you think about Sira Granthi, that is nothing but the group of the Sira. They are being seen as a matted appearance. Or otherwise, where there will be varicosity are being observed. For example, the varicosity of the lower limb, or otherwise the varicosity of the hemorrhoidal veins, etc. So they are categorized under Sira Granthi. As far as Agni aspect are concerned, so there may be a possibility of Agni Mandya, there may be a possibility of Agni Vriddhi, or there may be a possibility of Vishamagni. To analyze this, we have to know about the Jirnahara Lakshana. That is being mentioned that Udgara Siddhirutsaho Vegotsargo Yathochitah Lagutakshut Pipasa cha Jirnaharasya Lakshanam. So that means the person will be having the proper belching itself. So that means whatever the food substances is going to consume, those the taste will not be observed when the person is developing the belching. Utsaha, that means proper enthusiasm will be there. So that means the macromolecules will be converted into micromolecules. Vegotsargo yathochitah. So that means the person will be having the proper expulsion of the Vega. That means the Purisha Vega as well as Mutra Vega. So that means the person will be having the once in a day, or the movement of the fecal matter may be possible 5 to 6 times a day. Micturition may be there. Laghuta akshit pipasacha. Laghuta, in the sense the person will be having the lightness of the body because of the conversion of macromolecules into micromolecules. Shut pipasa, that is yathochita kshit pipasa. The person will be developing the timely appearance of appetite as well as thirst. When you are going to observe that these lakshana, that means we have to go backwards and we have to see the patterns of these different lakshana. Then only we are going to say whether the person is having Agni Mandya or Agni Vriddhi or Vishamagni. When you consider the ama, so we have to identify whether it is present in the Shakha or Koshtha or Marmasti Sandhi. When the person is consuming either Atyashana or Vishamashana or Samashana or Atyashana or Viruddhashana, etc., ama formation will be observed in the alimentary canal. When these macromolecules are damaging the gastric mucosa, when that enters into the intravascular compartment, and when these macromolecules are started entering into the interstitial compartment, then we are going to say the Dhatwagni affliction. When these macromolecules enter into the cells, then we are going to say there may be a possibility of Bhutagni affliction. In this way, so we have to identify the pathogens where it is being present, whether is it present in the alimentary canal, or whether is it present in the intravascular compartment, or whether is it present in the interstitial compartment, or whether is it present in the intracellular compartment. So that means if the pathogens are being present inside the bones, that is interstitial compartment of the bone, then we are going to say Astidhatwagni may be afflicted. Or if the person is having this particular the pathogens present in the bone marrow, that is interstitial compartment of the bone marrow, then we are going to say the Majja Dhatu affliction or Majja Dhatwagni affliction can be predicted. In this way, we have to analyze the ama affliction. As far as Udbhava Sthana are concerned, so only two types of Udbhava Sthana has been mentioned as far as the Ayurveda textbooks are concerned. It is either Amashaya or Pakvashaya. So that means more than 95% of the cases are manifested because of abnormal digestive fire or abnormal Jaఠragni. So that means they are considered to be Nija Vikara, wherein the Udbhava Sthana will be there in either Amashaya or Pakvashaya. So that means Amashaya are considered to be the seat of either Kapha or Pittaja Vikara, whereas the Pakvashaya is considered to be the seat of Vataja Vikara. That means when the person is having the Kapha dominant diseases, Urdhva Amashaya will be considered to be the site of the Udbhava Sthana there. Whereas in case of Pitta dominant diseases, Udbhava Sthana are considered to be Adho Amashaya as such. So that means lower part of the alimentary canal, that is the stomach as well as whole small intestine can be considered here. When you consider the Vata dominant diseases, Udbhava Sthana as such, that will be considered to be the Pakwashaya or large intestine as such. So that means the macromolecules, they may be present either in the stomach or small intestine or large intestine, depending upon the presence of the Nidana Sevana, depending upon the virulence of the Nidana Sevana, depending upon the number of the pathogens, that means the number of Nidana Sevana. As such, these macromolecules, they may be present either in the stomach, or they may present either in the small intestine, or they may be present either in the large intestine. From there, they enter into the intravascular compartment. From there, they are going to enter into the interstitial compartment. Later, that will be moving into the intracellular compartment as such. So here, Udbhava Sthana, in case of the Vata dominant diseases, Pakwasha is considered to be the Udbhava Sthana, whereas in case of Pitta as well as Kapha dominant diseases, there will be Amasha is considered to be the Udbhava Sthana. When you think about the Sanchara Sthana, there are among the Saptadhatu, two are considered to be liquid in nature, that is Rasa and Rakta. That is why whenever a person is suffering from either Rasa or Rakta Dhatu involved Vikara, in those situations, the Sanchara Sthana are considered to be Sarva Sharira. Otherwise, they are considered to be the localized ones. Pain in the right knee joint, for example, Sanchara Sthana will be restricted to right knee joint. Though that is the initially there may be a possibility of the presence of the pathogens from the alimentary canal. They are going to enter into that. Suppose if the Rasadhatu is being affected, if Rasadhatu is not being affected, probability here Sanchara Sthana as such, that will be mainly related to the external cause as such. When you think about the fever, Sanchara Sthana can be considered as Sarvadehika because Rasadhatu affliction is being seen. As far as Vyakta Sthana is concerned, Vyakta Sthana is considered to be the seat of Pratyatma Lakshana. Here the few examples are being mentioned. Kushta or Visarpa. Vyakta Sthana can be considered as Tvak. Urdhvaga Amla Pitta. Pratyatma Lakshana, the Vyakta Sthana can be considered as Hridaya, Kantha or Vaktra. In case of Atisara, Guda can be considered as Vyakta Sthana. Arshas, Guda is the Vyakta Sthana. Udara is the Vyakta Sthana of Gulma. Gridhrasi is having the Vyakta Sthana as Adhashchaka or lower limb. Visuchika, Sarva Sharira. Because Rasakshaya is there. Whenever there is a Rasakshaya, we are going to have the Sarvadehika Lakshana. Amavata, specifically Sandhi, are considered to be the Vyakta Sthana. Adhyasti, that is, the Asti is considered to be the Vyakta Sthana. In this way, Vyakta Sthana is the one where Pratyatma Lakshana are going to be seen. So that means we have to identify the Pratyatma Lakshana whenever we are going to interact with the patient. When you think about the Vyadhyavastha, we have to know about whether it is Sama or Nirama stage. At the beginning of Dosha as such, how to identify Sama, we have discussed. Whereas Uttana and Gambhira, so that means if the vitiated dosha are present between Tvak and Mamsa, then we are going to say it could be Uttana stage as such. If they are present in the Medas, Asti, Majja or Shukra, then we are going to say it could be Gambhira stage of illness. As far as Antarvegi and Bahirvegi concept are concerned, the Antarvegi as such, where the Lakshanas will be observed inside the body, whereas Bahirvegi in the sense, the person able to perceive the Lakshana as such. That is specifically observed in case of Jvara as such. Antarvegodika Trishna Pralapa Shwasanam Brahmaha Sandesti Shulamasvedo Doshavarcho Vinigraha Antarvegasya Lingani Jvarasyaitani Lakshaye. In this way, the Antarvega Lakshanas are being observed. Whereas Bahirvegi Jvara Lakshana, that is Santapo Bhyatiko Bahya Krishnadinam Chamardabam Bahirvegasya Lingani Sukhasadhyatvamevacha, because they are externally visible and we can give the appropriate line of treatment there. As far as Ashukari and Chirakari are concerned, where the term Ashukari refers to the sudden development of complications, whereas Chirakari refers to the gradual development of Upadrava or complications. As far as Rogamarga are concerned, whenever pathogens are only restricted in the alimentary canal, that is considered to be the seat where elimination is possible at the nearest root. So that means it is considered to be Sukhasadhya in nature. Whereas if the pathogens are being present in the alimentary canal as well as intravascular compartment, when you consider the first situation, this is a little bit difficult to cure. When you consider the pathogens are being present in the stomach or alimentary canal as well as intravascular compartment as well as interstitial compartment and intracellular compartment, this is considered to be the most difficult ones if this is being present. So here there are the three examples where pathogens may be residing in these areas, which is indicative of the severity of the disease as such. As it is being mentioned that the ideal line of treatment is to bring the dosha or the pathogens from the intravascular compartment to the alimentary canal. Or if the pathogens are present in the interstitial compartment, make it to bring it into the intravascular compartment, hence to alimentary canal. And if the pathogens present in the intracellular compartment, you have to make it into the interstitial compartment, then it has to be brought into the intravascular compartment, then it has to be brought into the alimentary canal, and later that has to be eliminated either through the oral route or rectal route. So this is the concept of Rogamarga. As far as Sadhyasadhyata of the diseases are concerned, so here these are the different parameters. We have to know about the number of dosha are being involved, whether is one dosha is afflicted or two dosha are afflicted or all the three doshas are being afflicted or not, that has to be noted. Or is there any involvement of manasika dosha are being present or not, that has to be analyzed. As far as number of Dushya are concerned, whether one dosha are being afflicted or two are afflicted or more than two are afflicted, that has to be noted. Number of Srotas afflicted, whether Abhyantara Srotas afflicted or Bahya Srotas is being afflicted, that has to be analyzed. If the one Srotas is being afflicted, then it is comparatively easier to cure. If multiple Srotas are afflicted, then they are considered to be difficult to cure. Duration of the illness. If the duration of the illness is shorter, then it is easy to cure. If the duration of the illness is longer or chronic ones, then it is comparatively difficult to cure. As far as the nature of the hetu are concerned, whether the hetu is of milder form, easy to cure. If it is considered to be of a moderate form, difficult to cure. If it is of a very severe form, very, very difficult to cure. As far as number of this distribution of the symptoms are concerned, if they are localized, easy to cure. For example, in case of the Amla Pitta as such, if it is generalized, such as Kushta, then it is difficult to cure. Rogamarga involved. If one Rogamarga afflicted, easy to cure. Two Rogamarga are afflicted, difficult to cure. All the three Rogamarga are afflicted, very difficult to cure or asadhya in nature. If the Upadrava are being present, comparatively difficult to cure. If the Upadravas are absent, then it is easy to cure. These are the parameters of analysis of Sadhyasadhyata. As far as Vyadhi Prakara are concerned, We have to know about whether it is Adhyatmika Vikara or Adhibhautika Vikara or Adhidaivika Vikara. Because each type of the Vikara are requiring specific line of management. Suppose if the person is suffering from Adhidaivika Vikara, if you are giving Yukti Vipasha Chikitsa, that may not be helpful at all. There, we need to have Daiva Vipasha Chikitsa also. Further, we have to know whether the particular disease a person is suffering from, whether it is Adibala Pravritta Vikara or Janma Bala Pravritta Vikara or Dosha Bala Pravritta Vikara or Sanghata Bala Pravritta Vikara or Kala Bala Pravritta Vikara or Daiva Bala Pravritta Vikara or Swabhava Bala Pravritta Vikara. Suppose if the person is suffering from the trauma, it is mainly moving towards Sanghata Bala Pravritta Vikara or Adi Bhautika Vikara. So like that, specific line of treatment can be planned. The third set of category, whether it is Mrudu, Madhya or Ati Matra Vikara. In the sense, the Mrudu Vikaras may require the simple Langhana or milder form of treatment. If the person is suffering from Madhyama Vikara as such, then we need to have somewhat more vigorous line of treatment may be required, such as Langhana, Pachana, etc. If the person is suffering from very severe form of the diseases, then we need to have the larger form of that is the more potent treatment may be required, such as Panchakarma or Shodhana therapy may be required. If the person is suffering from Ekadoshaja Vikara, comparatively easy to cure, simple. If the person is suffering Vataja Vikara, Vata Dosha Upakrama can be planned. If the person is suffering from Sandipadaja Vikara, then we have to analyze which is the most dominant dosha among them that has to be treated as such. As far as Mrudu or Dharana Vikara are concerned, Mrudu Vikara in the sense where the Roga Bala will be less, very easy to cure. Dharana Vikara where the Roga Bala will be more potent line of treatment may be required. Sharirika as well as Manasika Vikara are concerned, Sattva Avajaya Chikitsa may be required in case of Manasika Vikara, whereas Sharirika Dosha Chikitsa may be required in case of the Sharirika Vikara as such, that is Doshaja Vikara. Nija and Agantuja Vikara, Nija Vikara may be requiring the specific line of treatment, that is the Nija line of treatment, and Agantuja Vikara may require Agantuja line of treatment. This is how we have to analyze as far as the Vyadhi Prakara are concerned. So dear ANA community members, when you summarize all these, we have to know about the identifying the components of Samprapti. It is very, very essential when you are trying to break down the Samprapti of the disease. That is what we can say, Samprapti Vighatana. When you think about the Samprapti Ghataka, the factors are Dosha afflicted, Dhatu or Mala involved, Srotas afflicted, Srotodushti Prakara involved in the patient, type of the Agni, type of the Ama, Udbhava Sthana, Sanchara Sthana, Vyakta Sthana, Vyadhyavastha, Rogamarga, Sadhyasadhyata and Vyadhi Prakara. These are the factors that has to be recorded or documented. Whenever if you are doing this in the proper manner, that is helpful in the analysis of Roga assessment. And it is also helpful in clearly predicting the prognosis or Sadhyasadhyata of the disease, and we can able to plan right management of the disease in the diseased individuals. What are the major key takeaways from today's discussion? Dear ANA community, mention in the comment box below. And what is the one video that you would like to hear in this particular channel? Mention in the comment box below and spread this particular video to maximum number of true Ayurveda learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.